Hello, myself Dr. Indranil Halder, Associate Professor and Head, Department of Pulmonary Medicine, College of Medicine and JNM Hospital. In the last few weeks, we are seeing that the world is upside down because of the pandemic of novel coronavirus. In my video, I am going to show you some tips of how we can prevent the spread of the disease. Why we are so much frightened of this disease? It is because of the very high infective rate, and also we are yet to receive a vaccine of the disease, and also there is no definite specific treatment of the disease. Before we come to how we can prevent the spread of the disease, let us know how the disease is transmitted. The disease is transmitted mainly by airborne, by droplet infection and by aerosol, and secondly by fomite transmission. What is fomite transmission? Because of the droplet and the aerosol, the virus goes out into the air and stick to surface of different surfaces in the structures or things in the room. And once we touch those things and put up the hand over the face, in the nose or in the eyes, the virus goes inside our body. So how can I prevent all these things from being transmitted? Most important is the social distancing. The best way that we can do is a 1 meter distance, and government has taken a very good step in the lockdown which will prevent us from having gathering. But if we are going outside, for example to the marketplace, we have to keep a social distance of 1 meter. The next thing, since it is transmitted by aerosol and droplet, people who are having cough or respiratory infection, they should wear a mask. Now that the tendency is that everyone is wearing a mask, which is very good while they are going outside. But people who are having respiratory symptoms like cough, sneezing, they should cover up their mouth with a handkerchief or a tissue paper. But unfortunately, if they don't have the time to take up the handkerchief, they can cover up their mouth with their elbow. Next important thing is the prevent fomite transmission. We can do that very effectively by washing our hand. Soap and water is the best thing. Adequate time and the proper way of washing is important. The proper way is that we should wash the front of our hand, the back of our hand, both of these hands, in between the fingers. The thumb washing is very important, both the thumbs and the tip of the finger. This should take 20 seconds time, and free flowing water should be there. But in places where there is no provision for hand washing, the next alternative is to scrub our hand with hand sanitizer. Alcohol based hand sanitizer is the best, and in the same way as we washed our hand, the front, the back, in between the fingers, the thumb and the tip of the fingers should be washed. The another important thing is we should not touch our face consciously. That is, in places where we cannot wash our hand or hand sanitizer is not available, we should be very aware that we should not touch our face, because it is by that way that transmission of the virus occurs from fomite to our nose and the eyes. So by all these ways, that is cough hygiene, cough etiquette, social distancing and regular washing of our hands and not touching our face, we can prevent the disease from transmission, and we can be free of this dreaded disease. So thank you for watching the video.